Hello everyone, welcome to ITNS Academy. This is your mentor Dr. Shamaita Basu, and in this session we will be moving on to the next part of the second part of the topic of congenital malformations, deformations and chromosomal abnormalities. So I think by this session we will be able to complete this particular topic. So then we will be moving on to the next topic of or rather the next module of the course of medical coding. Okay. So in this session, we will be firstly starting with the subcodes that are running from Q35 to Q37. So I think till Q34 I have already discussed in the previous session or the previous video. So if you have not yet watched that video, then please go back and watch that video first and then come back to this video, because otherwise you will not be able to keep track and understand that what is actually going on. Okay, so as we can see, so these codes Q35 to Q37, they are actually corresponding to cleft lip and cleft palate. So first we will be talking about what is cleft lip, then cleft lip, and then we will be talking about what is cleft palate. So when we talk about cleft lip, so it is a congenital condition where a baby's upper lip has a split or opening, which occurs when the tissues of the lips do not join completely during fetal development, and it is actually a condition which is very much common. It's like widely seen in babies. It can affect one or both sides of the lip and may also extend into the nose. The cause is often a combination of genetic and environmental factors. Surgery is typically performed within the first few months of life to repair the cleft, helping improve appearance, feeding, and speech development. Early intervention and ongoing care from a team of specialists, including surgeons and speech therapists, are crucial for optimal outcomes. Okay, next we have cleft palate. So it's again a congenital condition where the roof of the mouth or palate does not fully form, leaving an opening that can extend into the nasal cavity. This condition can affect a baby's ability to feed, speak, and hear properly. It may occur in isolation or alongside a cleft lip, and its exact cause often involves a combination of genetic and environmental factors. So both the situations, both cleft lip and cleft palate, are actually having both genetic as well as environmental predisposition. Okay, treatment again will typically involve surgical correction within the first year of life, followed by speech therapy and other interventions as needed. Early intervention helps improve long-term outcomes for affected children. So I think till now, whatever conditions or whatever malformations we have talked about, uh, in most of the situations or in most of the conditions, we saw that surgery can be an option, but it's not the only option. We can also go for other treatments like therapy and all. But in case of cleft lip and cleft palate, surgery is the only option for ultimate treatment, because once the surgery is done, then only we can move on to other types of therapy like speech therapy, medications and all. Okay, so surgery is the primary thing that needs to be done if it's a cleft lip or a cleft palate. Okay, moving on to the next important condition, that is Q37, which corresponds to cleft palate with cleft lip. Means where the baby is having both cleft lip as well as cleft palate. So it will be affecting the upper lip as well as the roof of the mouth. They happen when the tissue that forms the roof of the mouth and upper lip don't join before birth. The problem can range from a small notch in the lip to a groove that runs into the roof of the mouth and nose. This can affect the way the child's face looks. It can also lead to problems like eating, talking, and ear infections. Treatment usually is surgery to close the lip and palate. Doctors often do this surgery in several stages. Usually the first surgery is during the baby's first year. With treatment, most children with cleft lip or palate do well. So it's not something that will be hampering the lifestyle of that particular baby in the future years in a very bad manner. But again, it's something that needs treatment, because otherwise there's a appearance of the physical appearance of a human being also matters a lot in the in the respective years of his or her life. So that's why it's from cosmetic or from physical appearance point of view also this surgery is important. And as far as these problems with eating, speaking and talking is involved, for those scenarios also surgery is important. Okay. Okay, moving on to the next important set of subcodes that we can see over here. So they are running from Q50 to Q56, and they are corresponding to congenital malformations of genital organs. So let's see what are the different codes that are there. So again, we can see that they are following the chronological manner, so no need to highlight anything. So first is Q50, which corresponds to congenital malformations of ovaries, fallopian tubes and broad ligaments. Then we have Q51, which corresponds to congenital malformations of uterus and cervix. Then we have Q52, which corresponds to other congenital malformations of female genitalia. Then we have Q53, which corresponds to undescended and ectopic testicle. Then we have Q54, which corresponds to hypospadias. Then we have Q55, which corresponds to other congenital malformations of male genital organs. Then we have Q56, which corresponds to indeterminate sex and pseudo hermaphrodism. Okay, so first we will be talking about Q50, which corresponds to congenital malformations of ovaries, fallopian tubes, and broad ligaments. So under this, the first condition that we need to talk about is developmental ovarian cyst. So now what is a cyst? So it's a fluid-filled sac that forms on or within an ovary. Since here we are talking about ovarian cyst only, but cyst is something which can form in any part of our body. Cyst can be seen in the stomach, cyst can be seen in the mammary gland. Okay. So it is typically a result of normal ovulatory processes. These cysts are common in females of reproductive age and are often benign, usually disappearing on their own without treatment. They can vary in size and are usually asymptomatic, though larger cysts may cause discomfort, bloating, or pelvic pain. In rare cases, complications such as cyst rupture or ovarian torsion may occur, requiring medical intervention. Most developmental ovarian cysts are monitored through regular ultrasounds to ensure they resolve naturally. So these developmental ovarian cysts are actually also known as functional ovarian cysts. So these are not necessarily pathological, or these are not necessarily disease causing, but yeah, they can become a problem, or they can lead to some pathological disorder. Okay. Moving on to the next important condition that we need to talk about. So that is congenital torsion of ovary. So it's a rare condition in which the ovary twists around its supporting ligaments. The ovarian ligaments are actually very much important for the proper ovulation process, and basically when the ovum comes out and it goes to the fallopian tube, for that particular process the ovarian ligaments are very much important. So unlike torsion that occurs due to cysts or tumors, congenital torsion happens without an obvious cause, often in infants or young children. Symptoms can include sudden abdominal pain, nausea, and vomiting, making early diagnosis crucial to prevent ovarian damage. Surgical intervention is typically required to untwist the ovary and restore normal blood flow. Okay, next we have accessory ovary. So it's a rare congenital anomaly where an additional ovarian tissue is found separate from the main ovary, often located near the fallopian tubes or in the broad ligament. It forms due to developmental errors during the embryonic phase. While it may remain asymptomatic, it can sometimes lead to complications like cyst formation or torsion. Surgical removal may be necessary if symptoms arise or if the accessory ovary is causing other health concerns. Okay, moving on to the next condition that we need to talk about, that is ovarian streak. So it refers to an underdeveloped ovary, often seen in individuals with certain genetic conditions like Turner syndrome. In this condition, the ovarian tissue is replaced by fibrous non-functional tissue, leading to infertility and a lack of normal hormone production. Streak ovaries are typically small and do not produce eggs or hormones needed for puberty. Hormonal replacement therapy is often needed to address the symptoms associated with ovarian streaks. The next important condition that we need to talk about is embryonic cyst of fallopian tube. So it's a rare benign fluid-filled structure that forms during fetal development due to the incomplete regression of embryonic ducts such as the Mullerian or the Wolffian ducts. These cysts are typically asymptomatic but can occasionally cause pain or be discovered incidentally during imaging or surgery. Though usually harmless, large or symptomatic cysts may require surgical removal to prevent complications like torsion or rupture. Diagnosis is often made through ultrasound or laparoscopy. Okay, next important condition that we need to talk about is embryonic cyst of broad ligament. So it's a benign fluid-filled cyst that forms due to remnants of embryonic structures such as the Wolffian or the Mullerian ducts during fetal development. These cysts are typically located between the layers of the broad ligament which supports the uterus and fallopian tubes. Most of the time they are asymptomatic and discovered incidentally during imaging or surgery, but larger cysts may cause discomfort, pain, or pressure on nearby organs. In symptomatic cases, surgical removal may be necessary to prevent complications like torsion or rupture. Okay, moving on to the next important subcode that we need to talk about, that is Q51, which corresponds to congenital malformations of uterus and cervix. So it results from abnormal development of the Mullerian ducts during embryonic life. These malformations include a variety of conditions such as a septate uterus, biconduit uterus, and uterine agenesis, each affecting the shape and function of the uterus and cervix. Such anomalies can lead to complications like recurrent miscarriages, infertility, or menstrual irregularities. Diagnosis is typically made through imaging techniques like ultrasound or MRI, and treatment may involve surgical correction depending on the type and severity of the malformation. Moving on to the next important subcode that we need to talk about, that is Q53, which corresponds to undescended and ectopic testicle, means basically the testis. So it's a condition in which one or both testicles, which are the male sexual organs, primary male sexual organs, they fail to move from the abdomen where they develop before birth into the scrotum. Undescended testicles may increase the risk for development of testicular cancer. Testicular descent is essential for normal spermatogenesis, means the process of formation or the process of generation of sperms or rather semen, which requires temperature lower than the body temperature. At least the temperature needs to be 2 degrees Celsius less than the normal body temperature of humans, that is 37 degrees Celsius. So cryptorchidism can be classified by the location of the mal-descended testis. So basically this condition is also known as cryptorchidism, and if it's not corrected surgically in early childhood, then it can lead to increased risk of testicular cancer later in life, and also it can lead to infertility and erection problems. Okay, moving on to the next important subcode that we need to talk about is that is Q54, which corresponds to hypospadias. So it's again a birth defect due to malformation of the urethra, in which the urethral opening is below its normal location. In the male, the malformed urethra generally opens on the ventral surface of the penis or the perineum. In the female, the malformed urethral opening is in the vagina. Okay, moving on to the next important conditions that we need to talk about, that is indeterminate sex and pseudohermaphrodism. So these are two separate conditions, or two separate malformations. Okay, so we will need to talk about it separately. So firstly we will be talking about indeterminate sex, and then we will be moving on to pseudohermaphrodism. So firstly, when we are talking about indeterminate sex, means sex which cannot be determined, isn't it? So it refers to a condition where an individual's physical characteristics do not clearly align with typical definitions of male or female at birth. Physical characteristics means obviously the primary and the secondary sexual organs are not properly developed, or are, rather they are not conventionally developed so as to mark that particular child as a male or a female. This may involve ambiguous genitalia, and the condition can result from various genetic, hormonal, or developmental factors. Diagnosis often requires genetic testing and hormone analysis, and management involves both medical intervention and careful psychosocial support. Okay, and then when we talk about pseudohermaphrodism, so it is a condition in which an individual has the chromosomal and gonadal sex of one gender, but external genitalia that resemble the opposite gender. So the chromosomal arrangement is of, but the external genitalia that is present, the genital organ that is present, that is resembling the other sex. Okay, so for example, in male pseudohermaphrodism, an individual has XY chromosomes and testes but may have female-like external genitalia. This condition is usually due to hormonal imbalances or enzyme deficiencies affecting sexual development during gestation. Treatment often involves addressing the underlying hormonal imbalance and in some cases surgery. Okay, moving on to the next important set of subcodes that we need to talk about. So as we can see, they are running from Q60 to Q64, and they are corresponding to congenital malformations of the urinary system. Okay, so let's see what are the different codes and subcodes that are there. So again, they are following the chronological manner. So firstly, we are having renal agenesis and other reduction defects of kidney. Then we have cystic kidney disease. Then we have congenital obstructive defects of renal pelvis and congenital malformations of ureter. Then we have other congenital malformations of kidney, and then we have other congenital malformations of urinary system. Okay, so firstly we will be talking about renal agenesis and related conditions, that is corresponding to the subcode Q60. So again, it's a congenital condition where one or both kidneys fail to develop during fetal development, resulting in a complete absence of kidney. When both kidneys are absent, it is termed as bilateral renal agenesis and is usually fatal shortly after birth due to lack of kidney function. Other reduction defects will include conditions like renal hypoplasia, where the kidneys are underdeveloped but present, and renal dysplasia, where the kidneys have abnormal structures. These conditions can lead to varying degrees of kidney function impairment and may require ongoing management or transplantation depending on the severity. Okay, next important condition that we need to talk about is Q61, which corresponds to cystic kidney disease. So it's a group of disorders characterized by the formation of fluid-filled cysts in the kidneys, which can impair kidney function over time. The most common form is autosomal dominant polycystic kidney disease, which is also abbreviated as ADPKD, which is inherited and leads to the development of numerous cysts that can cause hypertension, pain, and progressive kidney failure. Another type is autosomal recessive polycystic kidney disease, that is ARPKD, which often presents in infancy or early childhood and can lead to severe complications including liver diseases. Diagnosis typically involves imaging techniques such as ultrasound or CT scan, and management focuses on controlling symptoms and preventing complications. Okay, moving on to the next important subcode that we need to talk about, that is Q62, which corresponds to congenital obstructive defects of renal pelvis and congenital malformations of ureter. So it involves blockages at the junction where the renal pelvis meets the ureter, which can impede urine flow from the kidney to the bladder. These defects, such as ureteropelvic junction, that is UPG obstruction, can lead to kidney swelling, pain, and if untreated, potential loss of kidney function. Congenital malformations of the ureter include conditions like ureteral duplication or ureteral stricture, which affect the ureter's ability to transport urine efficiently. These anomalies can result in urinary tract infections, kidney damage, or obstructive symptoms. Diagnosis is typically made using imaging techniques such as ultrasound or CT scans, and treatment may involve surgical correction to restore normal urine flow and preserve kidney function. Okay, so moving on to the next important set of subcodes that we need to talk about. So as we can see, they are running from Q65 to Q79, and they are corresponding to congenital malformations and deformations of the musculoskeletal system. So let's see what are the different codes and subcodes that we can see over here. So first we have Q65, which corresponds to congenital deformities of hip. Then we have Q66, which corresponds to congenital deformities of feet. Then we have Q67. So I think they are following the chronological manner, so no need to mention. So next we have congenital musculoskeletal deformities of head, face, spine and chest. Then we have other congenital musculoskeletal deformities. Then we have polydactyly. Then we have syndactyly. Then we have reduction defects of upper limb, lower limb and unspecified limb respectively. Then we have other congenital malformations of limbs. Then we have other congenital malformations of skull and face bones. Then we have congenital malformations of spine and bony thorax. Then we have osteochondrodysplasia with defects of growth of tubular bones and spine. Then we have other osteochondrodysplasias, and lastly we have congenital malformations of muscular system that are not elsewhere classified. Okay, so the first code or the first condition that we need to talk about is Q65, which corresponds to congenital deformities of hip. So these are classified under ICD code Q65, which encompasses a range of conditions present at birth that affect the hip joint structure and function. These include developmental dysplasia of the hip, which is abbreviated as DDH, where the hip socket does not fully cover the ball of the femur, leading to instability or dislocation. Other deformities can involve improper formation or alignment of the hip joint, which may cause issues with movement or lead to early arthritis. Early diagnosis through physical examination and imaging, along with timely treatment such as bracing or surgery, is crucial to ensuring proper hip development and function. Next important code that we need to talk about is Q66, which corresponds to congenital deformities of feet. So these are alterations or deviations from normal shape or size which result in a disfigurement of the foot occurring at or before birth. Moving on to the next important subcode that we need to talk about, that is Q67, which corresponds to congenital musculoskeletal deformities of head, face, spine and chest. So these are again classified under ICD code Q67, which encompasses a range of structural abnormalities present at birth. These deformities can include craniosynostosis, where the skull bones fuse prematurely, leading to an abnormal head shape, facial clefts such as cleft lip and palate, which involve openings in the upper lip or palate, and scoliosis, which is a lateral curvature of the spine. Chest deformities might involve conditions like pectus excavatum or carinatum, affecting the chest wall's shape. Early diagnosis through physical examination and imaging is essential for managing these conditions, and treatment often involves surgery, physical therapy, or orthodontic interventions to improve function and appearance. Moving on to the next important subcode that we need to talk about, that is Q69, which corresponds to polydactyly. So it's a congenital abnormality characterized by more than 5 digits on a hand or foot. And then we have Q70, which corresponds to syndactyly. So it's again a congenital anomaly of the hand or foot marked by the webbing between adjacent fingers or toes. So basically what happens, ऐसे duck का होता है ना कि दोनों उंगली के बीच में there's no gap. There's a like a sheet or a web like structure which actually connects these two fingers. So exactly वैसा होता है. Okay. So these are classified as complete or incomplete by the degree of joining. They can also be simple or complex, and it indicates joining of only skin or soft tissue. Complex syndactyly marks joining of bony elements. Okay, next important subcode that we need to talk about is Q71, which corresponds to reduction defects of upper limb. So they refer to congenital malformations where parts of the arm, forearm, or hand are either underdeveloped or missing. These defects occur due to disruptions in limb development during early fetal growth, often resulting from genetic mutations or environmental factors. Depending on the severity, the condition can affect functional abilities like grasping or reaching. Treatment typically involves prosthetics, surgery, or therapy to enhance mobility and independence. Moving on to the next important code that we need to talk about, so that is Q72, which corresponds to reduction defects of lower limb. So these are again congenital conditions where parts of the leg such as the thigh, lower leg or foot are underdeveloped or absent. These defects arise due to disruptions during fetal development, potentially caused by genetic factors or environmental influences. The severity of the condition varies, affecting walking, balance and mobility. Management may include prosthetics, orthopedic surgery and rehabilitation to improve function and quality of life. Next we have Q73, which corresponds to reduction defects of unspecified limb. So it again refers to congenital malformations where a limb, either upper or lower, is underdeveloped or missing, but the specific limb is not clearly identified. These defects result from abnormalities during fetal development and can be caused by genetic factors or environmental influences. The condition can affect function depending on the limb and extent of the defect, and treatment may involve prosthetics, surgery, or therapy to enhance mobility and daily functioning. Moving on to the next important subcode that we need to talk about, that is Q76, which corresponds to congenital malformations of spine and bony thorax. So they again refer to structural abnormalities present at birth that affect the vertebrae or the rib cage. These defects can include conditions like scoliosis, spina bifida, or rib malformations, which result from improper development during fetal growth. Depending on the severity, they may lead to complications such as respiratory difficulties, spinal deformities, or impaired movement. Treatment often involves surgical correction, physical therapy, and long-term monitoring to manage symptoms and improve quality of life. Next important subcode that we need to talk about is Q77, which corresponds to osteochondrodysplasia with defects of growth of tubular bones and spine. So it is a group of congenital disorders that affect the development of bones and cartilage, particularly in the long bones, which are also known as the tubular bones, and the spine. These conditions lead to abnormal bone growth, resulting in short stature, skeletal deformities, and joint problems. Individuals with this disorder may experience issues with mobility, posture, and pain. Treatment focuses on managing symptoms, which can include orthopedic interventions, physical therapy, and sometimes surgery to improve function and quality of life. So I think that's it. We have completed, or we are done with this particular module of medical coding. So we will be soon moving on to the next important topic or module of medical coding. Till then, thank you and goodbye. Please like, share and subscribe ITLS Academy.